Hello there. Okay, so today we're talking about chapter 7 of your book. Um, Christopher Cowley's art chapter, Depression, Physician Assisted Suicide, and the Dutch Chabot case. So basically what happened? In the early 1990s, there was a woman named Miss Boscher who wanted to die. She was living in the Netherlands and she had clinical depression, and finally, she found a doctor, Dr. Chabot, who agreed to assist in her suicide. It went to the Supreme Court of the Netherlands. Okay, first of all, euthanasia is legal in the Netherlands. It went to the Supreme Court, and the Supreme Court found no criminal fault with Dr. Chabot's assisting Mrs. B in her suicide and her euthanasia. Now, Christopher Cowley is essentially arguing that it is immoral for a doctor to assist in the suicide of mentally ill people or clinically depressed people, which are mentally ill, who are mentally ill. Now, what's going on in the argument? Well, after elaborating on the nature of the Boscher case, Cowley says there are two kinds of traumas or illness. The first kind is somatic, and the second kind is mental illness, typified by depression. Now, somatic illness is body physical illness. Cowley says that there's nothing really wrong with helping to euthanize somebody who's suffering from a physical illness, but he does not think this applies to mental illness like depression. Basically, we can euthanize physical people. Cowley thinks it's morally acceptable, but we cannot euthanize depressed people. There's these two things, physical illness and mental illness, are disanalogous. What we can do for one should not apply to the other. That's the basis of Cowley's argument. Now, why? Where does he get this from? Well, he says that, look, on one hand, a diagnosis, a physical diagnosis, is sort of objective and cannot be really challenged. If somebody is dying of cancer, we know why they're dying, and we know that it's untreatable. We know when cancer is terminal. Similarly, of congestive heart failure, when it comes to a point of a physical illness and we can say that it's untreatable, everybody agrees on this, and that is fine and well. Depression, on the other hand, is not so clear cut. We don't know objectively when somebody is dying of depression. And also there is a claim that, hey, you're not dying of anything, you're just suffering. It won't kill you. So there is this difference between them. The second difference is essentially, look at, even if the diagnosis is valid that somebody is suffering from depression, they should not be allowed to kill themselves or be euthanized. Crowley's argument hinges on the claim that physical illness is different from mental illness. It is disanalogous. Now, what is the nature of this disanalogy? Why aren't they the same? One, physical illness can be observed and tracked in populations, particular populations. There's going to be so many people who have heart disease. There's going to be so many people who have terminal cancer. Mental illness, on the other hand, depression, on the other hand, isn't generalizable, according to Cowley. Well, you might want to think about that a bit. I'm not sure that you could say that depression isn't, that a whole population isn't depressed, and you couldn't trace out the causes for it. But anyway, Cowley's first point is, look at, physical illness can be tracked in populations, mental illness cannot be. A second thing, the second difference is, we can say when a physical illness is hopeless. We can say when a physical illness is beyond treatment. We can say with a physical illness, look, you're not going to get any better. This is going to maintain, or this is going to get worse, and it will kill you. We cannot say that with mental illness, according to Cowley. According to Cowley, look, if pharmaceuticals, pharmacological treatments have made rapid advances, and we can essentially treat depression. We can manage depression. We can alleviate the symptoms of clinical depression. And it might take some time, but drugs are wonderful, according to Cowley. So, because we can manage clinical depression, it is not ever hopeless. So again, just to summarize, the two differences. Physical illness can be tracked in populations. Cowley says mental illness cannot. Physical illness can, at some points, be deemed untreatable. There can be a hopeless case. There can be a case physically where somebody is too far gone, where their suffering will never be alleviated with physical illness. With mental illness, the case is never hopeless, according to Cowley. Because there are these two differences, then basically what happens for physical illness should not apply to mental illness like depression. Physical illness, euthanasia is a viable option, but mental illness is different in those two respects that I just elaborated, so therefore it should not ever end in euthanasia. That's the basic thrust of Cowley's argument. Could you push back on it? Yeah, probably you could. You could push back on it. You could say, well, yeah, societies are depressive. Maybe you could say that about America right now. This is just a depressed society. This is a mentally ill society. Maybe you could say that of some other countries or some other cities. Maybe. The other claim that mental illness is never hopeless because drugs work, well, that could be pushed back against pretty hardcore. However, Cowley doesn't do that. To understand the argument, all you need to know is mental illness and physical illness are disanalogous, and therefore you shouldn't have the right to euthanize. A doctor is morally wrong to euthanize depressed people. Now, the last short section of Cowley's argument is basically, look at, you shouldn't even be allowed to talk. Doctors should not even be allowed to talk to mentally ill patients to put it forward as a possibility, put euthanasia forward as a possibility, because mentally ill patients, depressed people, are highly vulnerable. So not only shouldn't you have euthanasia as an option for depressed people, you should not even present it as a possible treatment option for depressed people. And Cowley on page 111 draws a really nice summary of his argument. I'll just read it in full. I have been arguing against a medical doctor with all the state's recognition and the profession's moral authority assisting in the suicide of a justifiably depressed patient. That's on page 111 of your text. Though a person suffering from physical illness should get a doctor's assistance if they want to end their life, a depressed person should not. Mental illness is not analogous to physical illness. For Cowley, two moral claims follow from this. 1. A depressed person should not have access to the medical option of euthanasia. And 2. A doctor should not discuss euthanasia with a depressed person. That's it. That's all. Please review the handout, review the article, and answer the discussion question. I look forward to reading your answers. Have a great day.